Cervical cancer is the fourth most common cause of cancer in women worldwide. Approximately 600,000 women will be affected with cervical cancer. Approximately 350,000 will die from this disease this year. I want to make sure you understand what cervical cancer is and how we treat it. And today we're going to talk about one of the treatments, which is the conization of the cervix. If that sounds good to you, continue watching. Welcome back to my YouTube channel. My name is Dr. duPont. I'm a board-certified gynecologic oncologist, and I'm passionate about educating women so that they can live long, healthy lives. And I believe that begins with great health. Today, we're going to talk about a very common procedure called the conization of the cervix, and it's used to treat precancer changes of the cervix and also to diagnose early cancer of the cervix. Well, when we talk about cervical cancer, we do know that we have a great screening test, the Pap test. It's been out a long time, and it was named after Dr. Papillomavirus, and that's why we call it kind of short Pap test. But he was a physician that was a scientist that was studying changes in the cervix, and he noticed a pattern. And so what we do when we do the Pap test, in the U.S., we start at the age of 21, is we're looking for these abnormal cells that may show up on the cervix. The Pap test is easily tolerated. It's commonly done. And from ages 21 to 29, we usually do it every 3 years if your Paps have been normal. Of course, if you've had an abnormal Pap, your doctor may do your Pap test more often. Usually, we'll add HPV testing to the Pap test after age of 25 for primary HPV screening, or your doctor may wait until after 30 to do what's called a co-test, a Pap and an HPV test. We know that 99% of all cancers of the cervix are caused by human papillomavirus, so doing the Pap test and also HPV screening will allow us to pick up a lot of early cancers. So if you've had a Pap test and your doctor tells you that it's abnormal, it's usually to do a colposcopy of the cervix biopsies. And what the doctor or your provider is looking for is, are there any precancer changes that need to be evaluated quickly? And so the biopsy in the office is easy to be done. And typically we're looking for changes on the cervix that may signify that you have some precancer changes. Once you have your pathology results back, your doctor or healthcare provider will talk to you about those results. Typically, if you have mild dysplasia or something we call CIN1, we usually monitor those patients. So a lot of times your immune system will fight the virus and those changes will go away. In young, healthy women, a lot of times just repeating the Pap in a year is all that you need. But just make sure you follow up in that 1 year. If your provider tells you you have CIN2 or CIN3, which are precancer conditions, also your doctor may say moderate dysplasia or severe dysplasia. Kind of the terminology changes from time to time, but we kind of go back and forth between, depending on if we're talking about, the tissue sample, the cervix, or Pap test. But typically, if you have CIN2 or 3 on your biopsy, your doctor oftentimes will offer you an excision procedure. Now, one of the common ones is called a LEEP, the loop electrosurgical excision procedure, and that's often done in the office. It can also be done in the operating room. But another excision procedure is called the cold knife cone of the cervix. And we call it that because the biopsy is kind of like an ice cream cone shaped. So it's called cold knife cone because done with the scalpel, which is cold, and a knife. And it looks like an ice cream cone. So that's the cold knife cone procedure. Now, what is this procedure? Well, your doctor will talk to you about why you need to have it. And I often do this if I'm worried that someone may have an early cancer of the cervix. So let's say I did a biopsy in the office and it's suspicious for cancer, but I don't know, couldn't see the cancer. I'm not quite sure, is what stage the cancer is. So oftentimes I may do what's called a cold knife cone, which is just a bigger biopsy. Cold knife cone is also done if your doctor wants to make sure that they know the extent of your disease. So one thing that's different with the cold knife cone than the LEEP is that the margins are cleaner because we use a scalpel. Whereas with the LEEP procedure, we're using electricity, so the edges of the specimen are kind of cauterized or burned. And so sometimes if we're concerned about cancer, we want to make sure those margins can be easily evaluated. And so we may do a cold knife cone over a LEEP. A lot of times too, if I'm worried about someone having dysplasia higher up than I can see on the colposcopy, let's say it's in the inner cervical canal, and I do my biopsies in the office and the inner cervical carotidings are positive, sometimes I will do a cold knife cone because I'm worried about the margin status and I want to make sure that I've evaluated enough of the cervix to give the patient recommendations on treatment plans. And if I'm worried about cancer of the cervix, I may do a cold knife cone. So those are some of the reasons why a cold knife cone may be done over a LEEP. It does cause more bleeding because we use a scalpel, and so it typically is done in the operating room. where the bleeding can be controlled much easier. So once your doctor's talked to you about the colon cone and you've gone over the procedure and you've gotten your surgery scheduled, what happens next? So you'll go to the hospital, and the procedure is very similar to the biopsy you had in the office. You'll be put on an exam table or an operating room table where they have stirrups where your feet will be separated. A speculum will be used to see your cervix. Sometimes a doctor may put some vinegar on your cervix, another solution to be able to see the abnormal changes. But a scalpel is used to cut out a cone-shaped wedge of your cervix, and that is sent to the pathologist for evaluation. Typically, I'll put a stitch at 12 o'clock to help the pathologist orient the specimen because it'll be a circle so that they know what is up and what's down. And then the pathologist will look at that under the microscope and give your doctor a report. Typically, you'll come back to the office 1 or 2 weeks later, and the doctor will go over the pathology report. Some of the things that you may hear is that, the margin status, if there was residual dysplasia still there, was it all removed? Were the margins clear? The doctor may also tell you if there's any cancer or early cancer that was found on the colon specimen, or is there any residual dysplasia? So those are kind of things that your doctor will talk to you about. After the procedure's done, typically we'll put Moncel solution or some type of hemostatic agent to help with bleeding. One of the complications with this surgery is that, one, it does cause more bleeding, and it can also cause delayed bleeding. So you may have bleeding 3 to 4 weeks after the procedure. Not to be alarmed, but let your doctor know if you're bleeding heavier than, or if you're soaking more than 1 pad an hour for 2 straight hours, or if you're passing big clumps of tissue, let your provider know. The other complications of this procedure are also preterm labor, preterm delivery. Because we're taking a portion of the cervix away, although that tissue does grow back, it's not as strong as it was before the procedure was done. So sometimes it'll cause weakening of the cervix. And so if you get pregnant later, your obstetrician may measure the length of your cervix and keep an eye on it to make sure you don't go into early labor. It doesn't happen often, but it is one of the risks of the procedure. And then also another risk is cervical stenosis, where that opening of the cervix, the os that we call it, make it scarred. So sometimes it may be hard to get pregnant, or sometimes it may be hard to do additional evaluation in the office because that opening is scarred. So your doctor can easily dilate that, but it's just one of the common complications. But overall, the purpose of the test is to make sure that we treat any severe dysplasia or precancer changes, and also if there's an early cancer, that we're able to pick it up before it progresses to a more advanced cancer. So the colon cone of the cervix is an easy procedure. It's commonly done. It's very safe, but it does have risks. So definitely talk with your doctor if you have any questions. And if you're deciding, if you think you want to get pregnant in the future, talk to your doctor about that as well, and they'll discuss options with you. But just know that the purpose of the test is to remove any precancer changes, because we want to prevent cancer of the cervix. Because as you recall, worldwide, 600,000 women will be diagnosed with cervical cancer every year, and that's way too many women. I hope this was helpful. If you have any questions or comments, please leave them in the comment box below. If you want to see more videos on this topic, please watch this video next. Thank you.